Hello, everyone. I wanted to bring two of our experts from KSB Hospital in our pediatrics department, Dr. Natasha Noel and then Debbie Gortowski. Welcome to the program.
Thank you.
Hi, thank you.
So I wanted to talk to you, both of you, and ask a few questions about the COVID-19 vaccine that is approved for kids 12 years of age and older. And first, I'm going to start with you, Natasha. And would you mind helping us talk about how does the COVID-19 vaccine work?
Sure. So the COVID-19 vaccine works similarly to other vaccines that your child may have had in the past. The germ, the virus that causes COVID-19, invades and multiplies in the body. The vaccine stops this multiplication by teaching the immune system to recognize and make antibodies or proteins to fight this virus. After the vaccination, your child has less of a chance of getting COVID-19, and if they do get infected, they may not be as sick as they would have without the vaccine.
That's really helpful because basically what the vaccine does is just builds these antibodies that block the virus from replicating and reproducing, right? So that's a great way to think about that. Debbie, if I may ask you, how do we know COVID-19 vaccines are actually safe for kids? I mean, there's a lot of concerns in the media and people are reading things, which I encourage that parents do that, and then they bring that to us. But can you help us understand that a little bit?
Well, before getting the emergency use authorization from the FDA, they did numerous clinical trials and found that it was remarkably safe for adults and teenagers 18 and up. And then they continued with the clinical trials and got additional safety data for younger teens, and they just authorized it for kids age 12 and up. So clinical trials are underway right now for even younger kids, as young as 6 months and older.
Yes, and soon we'll probably have some data around that, right? If we can use the vaccines for kids younger than that. Yeah, that's very helpful. Thank you, Natasha. How effective are the vaccines?
Research has shown that these vaccines are highly effective at stopping people from getting COVID-19. In cases, which is rare, if you do get COVID-19, it helps prevent serious illness, hospitalization, and death in those who get it. Just to mention, scientists don't know how long immunity from the vaccine will protect people. It's still being looked at, and it would be made clearer in the future.
Sure, and that makes sense. Most of these vaccines that we get, even not COVID-19, but all the other vaccines that we give, it doesn't protect you completely from not getting the infection, but majority of the times you have a very mild infection, and
Right.
that's what we want basically. So, Debbie, how long does it take for the vaccines to create this immunity that will then block this virus from doing more harm once it gets into the body?
Well, the vaccine that's approved for 12 to 17-year-olds will take 2 weeks after the second dose because it's a 2-dose vaccine. And so after the second dose, 2 weeks, and the body has built up an immunity to protect against the COVID virus.
Okay, that's very helpful. And I believe the protection is like 95%, something that high, which is really good for a vaccine.
Right.
And which vaccine do you think, parents ask, right, which vaccine should my child get? What would you tell them?
Well, the only vaccine approved for kids 12 to 17 is the Pfizer vaccine. And again, it requires 2 doses of that. The kids 18 and older can choose the other 2 vaccines, which is Moderna and Johnson & Johnson.
Very good. So Pfizer for all kids 12 and above, as of right now, basically.
Right.
Okay, thank you. Natasha, now you probably have heard this a little bit, and parents are, some of the parents are concerned, right, about what are the side effects of these vaccines, and and then there's also concerns around, like, is it, if I'm breastfeeding, can I take the vaccine, and is there going to be like long-term fertility effects? I've heard some parents be concerned about that. So would you mind kind of wrapping us up with sort of what are the side effects of the vaccines and how concerned we should be about it?
Absolutely. Let me start by saying that the COVID-19 vaccine is safe. There are some short-term side effects that your child may experience. In clinical trials, some adolescents had no side effects, and some had side effects that were similar to what the adults had. These included pain at the vaccination site, pain, redness, swelling. They were also followed by fever. Some had chills, headache, fatigue, nausea. A couple also mentioned the pain in the muscles. So I would advise generally, if you're unsure about what to do, call your pediatrician and ask about medicines that would reduce these symptoms in your kid, but they would usually go away in a day or so. While also rare, some people had some serious allergic reactions to the COVID-19 vaccine. So that is why your child would need to wait 15 to 30 minutes after the vaccine is administered at the site so they could be monitored. If your child had a reaction to it, then medications that we could give also to quickly treat it. Long-term side effects, the CDC said was unlikely, so I won't even go into that. Of course, parents will have a lot of questions. They also ask about questions about fertility. As far as we know, there are no side effects regarding the COVID-19 vaccine and fertility. The vaccine does not affect puberty, it does not affect your child's reproductive development in any way. It is safe for pregnant women and anyone who wants to become pregnant in the future. And if you look at it, millions of people have gotten the vaccine thus far, and a lot of them have gone on to become pregnant since then, and some of them were pregnant at the time, and they have been closely monitored by doctors, and we have reported no safety problems. I will also add, of course, yes, for the breastfeeding moms, please feel free, please get the vaccine, as this confers immunity to your children, the babies who can't get a vaccine at this point in time.
That's very helpful. So it's from what you're saying, it sounds like really the side effects of the vaccines are very mild, like other vaccines, basically. And then with breastfeeding, it's actually an advantage, right? If the breastfeeding mothers actually are vaccinated, because they can pass those antibodies on to their baby, which will protect them. So
and at this point in time, we don't know when the vaccine would be approved for this younger age group.
Right. And so that'll help protect them, basically. So, and with fertility, not any long-term side effects, which is really good to know and hear. So, thank you for that. I know my son got his vaccine and he had very mild symptoms, and he's doing fine, and he's happy that he got his vaccine. So, which is good. My 10-year-old can't wait to get his vaccine. Both my kids actually like vaccines, so this is very helpful. Debbie, if you don't mind, if a parent wants to go find some more information, in the world of Google and searching and stuff, where would you point them out so that they can actually get the best information up to date?
Well, the CDC website is the place to go for that, as well as healthychildren.org. And healthychildren.org is the American Academy of Pediatrics website for parents, and it is full of information, not just for vaccines, but other things for caring for your children.
Yes, thank you very much. There's a lot of good information there in healthychildren.org. So thanks you both for joining us, and thank you for everything that you do at KSB Edwards Clinic and in pediatrics and taking care of all the children around our area. So appreciate you joining us. Thank you, and have a great rest of the day.
You too. Bye.
Bye.